Good morning, Dr. Bailey. Thank you so much for being with me today. I'm super excited to connect with you because, of course, as the audience will find out, you have a very interesting, unique perspective on cancer today. And I'd love for you to go ahead and introduce yourself to the audience and tell us a little bit about your educational background, which is very diverse and dynamic, and a little bit more about yourself.
Thank you for having me. So my name is Dr. Nia Bailey. I'm a radiation therapist by trade. I've also created a documentary, but we'll talk about that later. So right into my educational background. So I went to Immaculata University for 3 years and went to Thomas Jefferson. At the time, Immaculata had a program. So I was able to go to Immaculata for 3 years, like I said, and study allied health with the concentration in radiologic sciences. And then at Thomas Jefferson, I was able to study radiologic sciences with a concentration in radiation therapy. I received two bachelor's degrees, took my boards, became a radiation therapist. About a year later, I went to LaSalle University for my master's, and I studied education with a concentration of bilingual and bicultural studies. And then right after that, I went to Westchester University to get my doctorate in public administration. So that was sort of my journey
Incredible.
through life.
Absolutely incredible. Like I said, your background is so unique and so diverse. And I'm sure it's prepared you for a lot of things. I'd love to hear a little bit about your experience as a radiation therapist. When you and I first met, you sort of educated me on this really crazy trend that you were observing. And that trend essentially inspired you to do something else, which we'll go ahead and get into. But tell me a little bit about your experience as a radiation therapist. Tell us a little bit about what a radiation therapist is and what they do. And of course, tell us about this trend that you were observing.
Absolutely. So, radiation therapy, we admit the radiation to cancer patients. So, that just means that it's very localized. If I'm treating somebody for their breast, I'm localized and just solely treating on their breast. If it's their head, their prostate, we're very localized treatment. A lot of people
Mm-hmm.
get us confused, which I mean, it's fine with chemotherapy, but the difference is
Yes.
chemotherapy is systemic. So, if we're treating a woman for breast cancer, that's why you see her hair's not there, her nails, things like that, because it treats the entire body. With radiation,
Mm,
it's very localized. So I like to sort of decipher those two differences when describing what I do.
perfect. Yeah.
And the trend that I saw, and I always say to people when I was studying radiation therapy, right? I feel like it was learning pediatric cancer and then geriatric cancer, nothing in between. And I talked to
Oh,
my fellow, not fellow students, but I talk to my fellow coworkers, and we say the
mhm.
same thing. Like, yeah, we don't really remember anything in between. I'm sure it was taught, but we don't remember that. So, getting into the field, I was noticing a lot of women and men who are my age, and I'm like, well, I just turned 31. I don't remember a 31-year-old being getting cancer, breast cancer
Right.
specifically. So I kept seeing this trend of one woman who looked just like me. She had braids like me, 24 years old, and passed away of breast cancer. And I'm like, what's going on? A good friend of mine who looked just like you, and she passed away at 34. And I'm like, okay, I feel like we never learned about this. This is freaking me out. What is going on? Why are so many young people being diagnosed with cancer? And then
Right.
it made me even say there's no such thing as too young for cancer. And I think I knew that because there's pediatric cancer, but there were so many people who kept telling me, my doctor said, oh, you don't have cancer. You're too young for it. And I'm like, well, wait
Right.
a minute. That's clearly not even a thing. What
Right.
is happening? So I just noticed this trend of so many young people, and I mean from 18 to 40 and even 50 is young, but just that range specifically were coming in
Right.
for treatment.
Right. That's incredible. Were you able to sort of consult with physicians or scientists or anybody in the space that you could sort of that could sort of help you understand what was happening, what you were observing? Was anybody able to explain that to you?
No, I can't say that I really sat down in somebody's office and said, what's going on? But just by flyby conversation, like, hey, this person's so young. And they're just like, yeah, I know. It was just that kind of information. And a lot of the doctors that I work for, they are relatively young. So, they're creating papers and research studies just like, hey, I'm seeing these influx of young individuals. What's going on, which is great. I mean, we're going to find out in the future what's going on and hopefully prevent that. But the now, we need the now. What's going on and how can we help now?
Absolutely. Yeah. And we are seeing this disturbing trend of cancer growing in the younger demographics, especially GI cancers is something that I think, the science is picking up on. But what were you seeing most of? What types of cancers were you seeing?
Breast cancer.
Breast. Yeah.
Yes,
And I imagine mostly women, although men can get breast cancer, it was
correct.
mostly women, right?
Correct. Previously I would see mostly breast in women. Now I feel like I'm seeing a lot of colon, a lot of
Colon.
rectum,
Right.
and multiple myeloma
Wow.
in
That's
like
incredible.
40s or 50s. And I'm like, once again, when I was learning it, I feel like it was 70s, 80s, not 40s or 50s. So it just,
And uh, it is insane. I'm sorry to cut you off. A question though, and of course, as you're talking, I'm thinking of all these questions. Um, are you finding that any of these individuals have unique behaviors that maybe are contributing to the development of their cancers? Meaning, are any of them smokers, or
right.
are any of them, have particular lifestyles that maybe make them more at risk for cancer? Or are you seeing that everybody's just kind of, in the same, standard line, and there are no real, outliers to their behaviors? What are you
Right.
noticing?
I would have to say it's a variation. So some people, they did smoke, they did drink, the classic, and not to say they deserve a cancer at all, but I'm just
Of
saying that
course.
classic, but that classic, you smoke, so then that's why you have cancer. But some, they literally ate air. They exercise 5 times a day, but I have to
Yeah.
say, um, what I've noticed, and this is just where I am, it's the demographic where they live. So I don't know if they live there their entire lives or
Mm,
lived there for 5, 10 years. But I have to say, out of what I do know, is the particular environment that they're in.
absolutely. Very
Mhm.
interesting. So interesting. Now, tell us what this trend that you observed inspired you to do.
It's inspired me to create a documentary. It's inspired me to talk to wonderful people like you and your organization, because we have to figure out the now, and I think it's beautiful that we're writing articles and consulting with other individuals, but it's happening now. We need to know now. So specifically with me, I wrote a documentary called A Letter to My Sisters, a breast cancer documentary for young women. And I was able to interview 3 phenomenal women as they told their story through breast cancer. So the one woman, she's Jamaican, Asian, and or Chinese specifically, and Puerto Rican, and she told her story at being diagnosed at the age of 29. The second woman,
Wow.
her name is Brenda Durantes. She was diagnosed in her 30s. She's Mexican American. In her interviews in Spanish, thank God my best friend came all the way from California to do that, because I am not that fluent in Spanish. Um, and the last woman, certainly not least, Lynn Mitchell, she is Swedish, German, and Irish, and she was diagnosed when she was 41 years old. So just trying to get a very diverse background of women to say, hey, breast cancer does not have to be a death sentence, because we are alive and we are thriving, but these are our stories, and we want to give you some tools and resources that you can use for yourself to bring to your doctor to save your life and to save generations behind us as well.
That's so incredible. And so all of these women are, inspired to help
Mhm.
save somebody if they can by sharing their personal story and their journey with cancer. That's so incredible. When is the documentary going to be available for all of us to
Yes.
watch?
Yes, it's going to be available October 7th at the Philadelphia Museum of Art. Right now, we're just doing screenings right now. And then we have some phenomenal guests coming. The Philadelphia Mayor, Jim Kenney, he'll be there. Pennsylvania Speaker of the House, Joanna McClinton, and then everybody in the community just trying to get the information out there.
That's so cool. Now, I'm in Florida. Is there any way that I can view the documentary at
Yes,
at this end? Okay.
yeah, absolutely. So I could always send it, but the goal is that we want to. So, like, if you watched it, the goal would be, maybe get 5 or 10 people, to watch it together so you can start that conversation with each other. And it's so
Sure.
funny. A lot of people say, well, maybe I need to talk to my family about my family cancer history. Maybe I need
Mhm.
to roll in clinical trials, or maybe I even need to do genetic testing because that's something that a lot of people have been doing.
That's such a good segue into my next question for you. I'm really curious to understand how genetic testing was involved in the healthcare, or maybe not involved at all, in the healthcare of the women that you've observed in as being a radiation therapist, and the women in the documentary as well. Do you know what their experience was with genetic testing? Did they receive it? Did they talk about it? Did they get it? Did their insurance cover it? What was their story with genetic testing?
So what I do know is they received I don't mean this in a rude way, basic panel of genetic testing. And every
Hmm.
woman always said to me, I don't have BRCA1 or BRCA2,
Hmm.
not knowing that there's other genetics to be tested for. So they
That's
just said,
right.
I don't have, I'm negative for genetics. My family's fine. But they found that so interesting. One woman, in particular, my friend Jacqueline Smith, she said, well, it's very interesting because my grandmom had it and this person had it. So I thought that, it would read that I have some BRCA1 or BRCA2, but it didn't read that. And a lot of people say to me, well, I don't have family cancer, a history of family cancer. So I was even surprised that I had it. And then I was more confused when I got the genetic testing and it said I don't have BRCA1 or BRCA2.
Right.
But
So basically what you're saying is that they did receive genetic testing, but they only received genetic testing on BRCA1 and BRCA2, which obviously we understand that, mutations in BRCA1 and BRCA2 are really, very well understood and tied to breast cancer and ovarian cancer. But they didn't receive genetic testing for any other gene that is also known to be attributed to breast cancer.
right. And if
So,
sorry. But
no,
if
go
they
ahead.
did, they just didn't say that to me. They were just focused on the BRCA1 or BRCA2. But I have to say, learning about Panacea, I am almost certain they didn't receive a slew of genetic
Oh,
testing to be tested. So that's what
absolutely.
so that's the
Ab-
difference.
Sure. I mean, the most common thing that I see is either people are not getting genetic testing at all, which is
Right.
the most common thing.
That's true.
And if they are getting genetic testing, just like you said, they're getting one gene that's screened, or two, usually BRCA1, BRCA2, depending on the cancer, of course, that they might have. And then if they're really lucky, they're getting a large panel, which includes multiple genes, sometimes 100, 200 genes, that are all pretty well understood to be linked to a variety of different cancers. But nobody today, nobody is getting comprehensive genetic testing like whole exome or whole genome sequencing. It's just so uncommon and so unusual. And so, just like you were saying, and thank you for bringing that up, that's our goal. That's our mission: is to get comprehensive genetic testing to be the standard, so that nothing is missed, and people can have this information for the rest of their lives, and they can constantly reference all of the new scientific updates and new scientific findings against their exome, because your exome doesn't change, right? This is something you're born with, and it doesn't change. And so that information is really valuable your whole life. And
Right.
if you don't get every gene sequenced, you're missing out on information. And
Right.
sometimes you might have a change in a gene that isn't understood yet.
Right.
And if you don't get that sequence, then you'll never have that information unless you retake a panel test, which a lot of people don't do that.
Right.
So having whole exome sequencing and having that data all in front of you all at once is really so valuable and the right thing to do for people. And that's exactly what we're trying to do at Panacea. So thank you so much for bringing that
Absolutely. And I have to say, you are teaching me because we are just,
up.
I don't know, taught to say, I don't know how to phrase it, but it's just, oh, you got genetic testing or you didn't. There was no, unless I missed this, breakdown on the specific genetic testings to get.
Oh yeah. Oh yeah.
You taught this to me. And even, I have a friend who, I mean, her story is dynamic. Her mother passed, or she was diagnosed, her mother was diagnosed in 1999 of breast cancer. She passed
Mm.
in 2002. And my
Oh,
friend, she is phenomenal. She was like, you know what, I need to get genetic testing. And they just, like we said, tested one or two. And at the age of 39, she was diagnosed with colon cancer. And it was like, wait, hold on,
oh,
this was not on my radar at all.
yeah,
I
right.
was so focused on breast, not colon. So she went back to her genetic counselor and said, hey, I need to be tested. And the genetic counselor said, well, no, I don't think so. And she was like, I was diagnosed with colon cancer. And she was like, oh, okay, let's do another panel. And
Oh
it
my,
came back that she has a specific gene that increases her risk of not only breast, but colon.
but colon.
So if she didn't advocate for herself or even know to go back, I don't even think I would know to go back. I would just be so, stressed that I have colon cancer
Exactly.
to go back and to advocate for herself. But now look at this. And 4 months later, she was diagnosed with breast cancer.
After the colon cancer. Oh, you're joking. Oh my gosh.
And to take it like another level, she pushed her two siblings to get tested, not just one or two, the comprehensive testing, right? Her sister and brother both have either BRCA1 or BRCA2. So her younger sister, got the elective double mastectomy and all that. But
Oh wow.
it wasn't for her. First of all, she says like she credits her mom, and she saved all her mom's information. But if it wasn't for her pushing,
Yes.
and I don't even know if she knew comprehensive genetic testing, but just for her to push, she was able to get it. And she's here today to tell her story.
That is so incredible. And it really does take such a unique individual, a strong, determined individual to advocate for themselves. And it shouldn't really be that hard for people to advocate for themselves and for people to get a simple life-saving genetic test. It should not be that hard, but sometimes it really is. And if it's not for, individuals like your friend who is incredibly determined and educated and informed, people are never going to know that they have these genetic changes that could put them at serious greater risk for developing these problems, and they're never going to be able to get ahead of these issues.
Right.
So God bless your friend. What a hero.
She is.
I hope there are more people like her, but hopefully Panacea can essentially make it a lot easier for people who just really want to have access to their genetic information so that they can get in control of their health and, prevent disease. That's our whole mission is to be the advocates for people so that
Yes.
people can
And
just
this
be
is,
empowered.
yeah, sorry. And I'm so excited because this is why Panacea is needed, because to get comprehensive information of the DNA in you, that's life-saving.
I know
Are you
it really
kidding
is.
me? I mean, everybody needs to have Panacea in their lives, not only if you have cancer right now, but for me, right? So my father had prostate cancer.
Oh
He did
wow.
not get genetic testing. Don't ask me why. I don't know if it was offered to him and he said no, but I mentioned it to him after speaking with you and he was like, I'm not doing it. I'm like, fine, I'll do it. And it
Right.
came back because I knew to say comprehensive because of Panacea. It came back that I have a gene, BCL6, that increases my risk for lymphoma. And I would have never,
Oh
ever
my God.
thought to even think of that, right? But
Oh,
because
that's
I had
incredible.
that tool with me, that Panacea gave me, I was able to get that information. And it's so important to do. And now, because of you influenced my mom to go and get testing. And, I have a very vast background of cancer in my family, and hers is crazier because all of her uncles and aunts have every type of cancer, breast,
Oh
colon,
wow.
lung, et cetera, et cetera. So you are empowering people to bring this information to their doctors and say, this is what I need. And it's so, knowledge is power. So if my mom comes back with something, she has the tools to save her life. This is what Panacea is doing. And this is
Oh, that's so
the
wonderful.
entire world needs to have Panacea in their life, because life, I'm serious. I mean, to have that that knowledge, and just, there's not a lot of control we have over our lives sometimes, but
Right.
to have that control, oh, I'll take it. And I know everybody would take it.
Yeah. Yeah. No, thank you so much for saying that. You make me sound so much more cool than I really am.
No,
Um,
telling you, it's so important.
Thank you. Yeah. So, and genetic testing, just as you said, is a really powerful tool. There's obviously limitations to genetic testing, and genetic testing might not really be for everyone.
Mhm.
And we always want to be honest and transparent about the realities, right? But it really is an underutilized, powerful tool. And I feel, and I'm sure many other people who know a lot more than I do would agree, that disease prevention is really about being able to accomplish multiple things, and being able to have, or create this tool shed of things that are going to put you in a better situation. And one of those tools, there's many tools, but
Right.
one of those tools that is really, really powerful is comprehensive genetic testing, because it can give you a really good map of what is held in your DNA.
Mhm.
And although we can't really necessarily make direct changes to our DNA, not yet, it's coming, right? And it happens in very rare specific situations, DNA editing, gene editing. But the key here is that you have this information, and the powerful thing is that science and technology and medicine has available interventions that can help reduce that risk for you. So you're not necessarily going in there and changing your DNA, but you're getting ahead of your DNA. You're outsmarting your DNA. And because of that, you're empowered. And because of that, you can get in control of your health. So that's kind of why comprehensive genetic testing is super, super powerful. And the reason why, as you mentioned, comprehensive genetic testing is really the key here is because sometimes you don't even know what you're looking for. Sometimes you might have a family history of breast cancer, and then the obvious choice would be to sequence your BRCA1 and BRCA2 gene. But there's so many other genes that actually, if there are changes in those genes, can increase your risk for breast cancer and other types of cancers. So if you don't sequence anything except BRCA, you're going to miss out on that information. And so that's why it's super important to have really comprehensive testing and not cherry pick the genes that you're sequencing. Why not, right? It's available. It's
Yep.
available, and companies like Panacea are trying really hard to make that comprehensive, whole exome sequencing affordable for people.
Which is so important. And Panacea, what you guys do, you break down the cost considerably.
We
And,
do, yeah.
but I like to say that, and like you said, being honest and transparent, there's so many things that as consumers we pay for that's not beneficial to our health, right? So if we don't do literally 3 or 4 things that's not beneficial to our health, right? Pay for Panacea to take care of our to look through our comprehensive sequencing, where it pays itself.
It really does. And you're right. And this is a good point to actually highlight, because whole exome sequencing today, on average, at a reputable genetics lab, could be as high as $9,000. It's a very pricey test. But what we've been able to do with our lab partners is we've been able to bring that test down to under $1,000 with physician oversight and genetic counseling and an at-home kit. So it's a substantial decrease in the cost, and it includes so much more than a lot of labs are offering, most labs are just offering the test itself, right? You have to find your doctor, you have to find a genetic counselor, you have to go to a lab and get your blood drawn in most cases. So what we've been able to do, thankfully, to our innovative lab partners and our genetic counseling partners and our physician partners, is deliver a life-saving comprehensive test for a fraction of the price. And it comes straight to your home. The kit literally gets shipped to your door. Like, what more could you ask for,
You're right. You're right.
So yeah, the cost definitely is, and $1,000, Nia, I mean, it's still not totally cheap, right? I get it.
Right.
But just like you said, if you can cut back on 2 or 3 things, maybe don't go out to dinner a couple times, or maybe don't buy those shoes. That would be where I would cut costs. But little tiny things like that, and you could really afford to do this test and save your own life potentially. So you're spot on. You're spot on. So obviously, we've sort of highlighted, the value that genetic testing brings and the value potentially that Panacea would bring with comprehensive genetic testing and expert guidance like genetic counselors and doctors. Would you say that in your experience, you know how difficult it was for people to get genetic testing and how your friend had to advocate for herself? What are your thoughts on the Panacea process? Basically, how we're able to bring this test to people, and how easy it is to essentially access online. How would you say that improves the access to testing?
1,000%. It's so seamless. Panacea process is so seamless because, as you mentioned, and I think especially post COVID, and I hate using that, but it's so true. Post COVID, me as the person who was diagnosed, I have to contact my medical oncologist, my radiation oncologist, maybe social work, and there's no help. And I guess that's maybe lack of a nurse navigator or whatever the case may be. But the fact is, Panacea just says, hey, just come on the website, put your information in, we will deliver it to you. All you have to do is do one simple thing, deliver it back, and then we'll have the information to you. It's so seamless, and it helps 1,000% because the patients that I've seen and that it's just too much information. Can you just tell me where to go and I'll do it? That's it.
Yeah.
All I want to do. So the Panacea process is so seamless, and it's so seamless, but so vital, so important. It cuts back on so much work that the patient has to do.
Yeah.
It's so much work that the provider has to do. Hey, as the provider, this is where I want you to go, get it done, and we'll have so much information for you.
Exactly.
Everybody.
Exactly. And that you brought up a very good point. The provider themselves sometimes don't know where to send the patient for genetic testing, where to find a genetic counselor. They don't know how to guide the patient. And so we take that burden off of the physician. That's such a good point. And then once the patient gets testing from Panacea, they sit down with our genetic counselors. They can take all of that, basically, that whole wrapped up package, the report, the results, and the summary from the genetic counselor to their doctor. And then the doctor has an entirely summarized, plan, basically. And then the doctor can say, all right, here are your results. You're at increased risk for breast cancer. I know what to do with that. We need to get you more frequent mammograms. We need to get you more blood work, whatever, maybe consider a mastectomy, depending on the type of gene that you might have. But the work is really removed, or the burden is really removed from the providers and, of course, the patients, because we sort of fuse this whole process into one simple workflow, and we make the access and the affordability of the testing just 10 times better. So that's a really good point.
It's so important. Oh my goodness. I just see everybody so busy and so inundated. There's like we both said, there's an increased load of patients, young patients being diagnosed with cancer, and everybody just doesn't have time, right? So helps. Panacea helps with the time. Like you said, the provider, hey, this is what you need to do. The patient gets the information, and now we both have a plan of what to do.
Exactly.
Mhm.
Exactly. Oh, you're so kind. You always, speaking to you is just always such a pleasure because you get it. You really get it. You understand what the problems are in this space. You've observed them, and you fully grasp the solution that Panacea is essentially pushing out. And it's so refreshing to hear that. So thank you
Absolutely.
so much.
Well, thank you for creating fantasy. I mean, oh my gosh, you realize the need and what needed to happen.
Well, I appreciate that. I promise you it wasn't me. I have incredible partners and co-founders and people who are 10,000 times more educated, more experienced than I am. And without them, none of this would be possible. So this is not me. I'm the face.
Well, I
I'm
don't
the
want
face
you
of
to
Panacea.
decrease your value and what you bring to it. I mean, that's beautiful that you recognize your partners and you're all in it together, but don't decrease your value. You're just as important and intelligent, and you're bringing this information out there. So thank you.
Thank you, Nia. You're the best. Thank you so much.
You're welcome.
And I am so excited to see the documentary, and I already have friends that are super excited to see it as well. So we will certainly be your viewers in Florida. Maybe you're probably not your only viewers, but you're maybe one of your earliest Florida viewers. But what you're doing is so awesome. You are just so great and such a pleasure to speak with. You're so informed. You're so inspiring, and you're doing important things just as much as Panacea. So thank you, thank you, thank you.
Thank you for having me. I appreciate you.
All right, and we'll continue, of course, talking on different occasions as well.
Thank you.
Thank you. Take care.